Good morning, everyone. I am Adila Saleh, and I will be presenting a comprehensive literature review on the impact of professional burnout on work performance among nurses. This topic is highly significant considering the current healthcare climate. We aim to unpack this issue to gain a deeper understanding of its causes, impacts, and potential mitigating strategies. For practicum site, it was at the Iowa City VA Medical Center. It is an 83 inpatient bed medical center that provides services to thousands of veterans in Iowa City area. This healthcare facility operated within the Iowa City VA healthcare system and provide a range of medical and nursing services, including primary care, specialty care, mental health services, and rehab services. Through its dedicated workforce, the medical center aims to provide high-quality, compassionate care for our veterans, ensuring they have access to healthcare services they need, and it often collaborate with other healthcare providers and organizations to ensure comprehensive care for veterans. Following comprehensive discussion with preceptor, I began my practicum project with an in-depth needs assessment. A review of existing literature emphasized the widespread problem of nurse burnout in the healthcare sector, both domestically and internationally. Despite lots of research on the topic, there hasn't been enough attention given to how burnout directly impacts nurses' job performance. This gap in research highlights the need for a deeper look into how nurse burnout affects their work. Based on experience in medical surgical units and discussion with the flu nurses in the external support group I am part of, it is clear we need more research to address nurse burnout urgently. The group shared valuable insight on way to tackle burnout and reduce turnover rates. Their suggestions included ensuring there are enough nurses on each shift, making breaks mandatory, and increase compensation. The informal survey results were telling. 22 emphasized the importance of adequate staffing, 17 stressed mandatory breaks, 17 called for burnout awareness programs, and 9 highlighted the need for better pay. Many studies have investigated the prevalence of nurse burnout across different healthcare settings and specialties. The results have shown varying prevalence rate of nurse burnout, ranging from around 30% to 50% across different healthcare settings. Intensive care, emergency department, and medical surgical units often report high rates of burnout due to the demanding nature of the work and high stress environments. Professionals and occupational burnout is a major problem affecting the nursing workforce, both nationally and internationally. Although multiple researchers have in the past attempted to find a lasting solution to this problem, nurses in various nursing units continue suffering the effect of burnout. The burnout problem does not only affect nursing professionals, patients, and healthcare organizations also suffer from this nursing and healthcare issue. The proposed quality improvement project examined literature in attempt to answer two main questions. What causes professional burnout among nurses, and what impact does it have on nurses and patients? And what interventions are available to help nurses cope and manage the impact of occupational burnout? The main aim of this literature review was to determine the actual impact of professional burnout on nurses' workforce. To achieve this, a comprehensive literature review to create an evidence-based need assessment for nurses in the healthcare setting was conducted. The second goal that this literature review project sought to achieve was identification of the aim, cause, and prevention strategies for dealing with burnout. Finally, the practicum project aimed to gather evidence that could lead in development of burnout reduction program for future implementation with nurses in the practicum site. The literature searched for applicable articles on the topic under investigation. The guiding questions were as follows. What causes professional burnout among nurses? What is the impact of burnout on nurses' well-being? How does burnout in nursing impact patient safety? And what evidence-based solution can be implemented to prevent professional burnout among nurses? Following this research, 3 evaluation strategies emerged: nurses' turnover rate, nurses' satisfaction, and the patient experience. These evaluation strategies demonstrated their effectiveness in identification of causes, impact, and solution for burnout issue in nursing. According to the literature review, the stress work environment in which nurses operate is a major factor causing burnout among nurses. Nursing is highly demanded professional, which exposes nurses to stressful events. For instance, nurses often have to deal with patients and families who are in distress. As a result, nurses are frequently called upon to offer emotional support, which can have adverse effect on their mental health. Shortage and understaffing of the nursing workforce is another factor contributing to the increase of professional burnout among nurses. The literature review showed that nurses are suffering occupational burnout due to increased workloads, occasionally by shortage and understaffing issues. Deteriorating patient satisfaction and poor patient outcomes were the main effects on professional burnout had on patients. Studies reviewed in this literature review indicated that patients suffered adverse effects when nurses experience burnout, primarily due to decline in nurses' work attitude, leading to a decrease in quality of care that they provided to patients. Professional burnout among nurses has encouraged unprofessional behavior which compromised patient safety. The main stakeholders of the quality improvement project are the Iowa City Medical Center staff nurses and healthcare facility clinical managers and supervisors. In addition to nurses, the practicum project may also impact other stakeholders, including patients, their families, and healthcare providers like physicians. Addressing the knowledge gap on nursing burnout can lead to improved holistic well-being for nurses, which in turn may enhance the quality of patient care. When nursing care quality improves, patients often experience faster recovery rates, leading to shorter hospital stay. This improvement can also result in financial and time saving for patients' families. Furthermore, healthcare providers may benefit from a stronger and more meaningful working relationship with nurses, fostering enhanced collaboration, such as effective collaboration can contribute to improved mental well-being among healthcare team and reduce the risk of burnout. Since this project was conducted through a comprehensive literature review. It was not implemented. However, the findings of this project present a practical implementation opportunity for a program aiming to deal with burnout issue on nurses. According to these findings, interventions seeking to increase resiliency showed favorable outcomes in addressing nurse burnout. Healthcare organizations can benefit by establishing resiliency training programs. The stress management and resilience training program is a good example of that. Unlike other interventions that target nurses already suffering the occupational burnout syndrome, interventions such as SMART programs seek to prevent burnout by providing nurses with the skill to cope with the problem before it becomes a deeper problem. Implementation of this program can be a benefit to nurses by preventing burnout, and it can also benefit the overall healthcare organization and patients, as nurses who are not suffering from burnout are likely to become more efficient and provide better care. The next phase of the project will involve implementing programs that provide nurses with the skill to cope with burnout syndrome. In this phase, resiliency and mindfulness training program would be implemented through a selected unit of healthcare facility. Prior to the start of this project, I set some professional and personal goals. One of the professional goals that I had set was to advance in my education. The stage we are in is an indication that a major portion of this goal has been achieved. Another professional goal is taking up a leadership role. Although this goal is still priority, I trust that my success in educational advancement will aid in my quest for career advancement in nursing and the healthcare professional in general. The quality and safety education for nurses competencies I had set fall under the evidence-based practice and quality improvement section of the competencies. In particular, I aimed to participate in a project aiming to restructure work environment and identification of best practice in nursing care. Furthermore, the project conducted addressed both competencies. The review examined the impact of professional burnout on nurses' job performance. The findings show that burnout negatively impacts nurses' performance, which compromises their ability to provide safe and high-quality care to patients. The finding also showed the importance of resiliency in countering the impact of burnout on nurses. Creating supportive work environment is a key strategy to healthcare organizations to help nurses manage their stressful work conditions. This can be implemented by developing organizational policies and initiating education and training programs aimed at enhancing resilience.